Spanish flu. In 2005, scientists in Atlanta made a crazy decision. What did they decide to do, you ask? To bring back history's deadliest virus, the Spanish flu. It had killed 50 million people. Some estimates say 100 million. But scientists were determined to recreate this monster. Millions of dollars were spent. Virus fragments were extracted from frozen corpses in Alaska. This death code that had remained in ice for 87 years was reconstructed molecule by molecule. The H1N1 strain was completely copied. Every gene sequence was meticulously replicated. So what was the result of this insane plan? In 2014, the nightmare began in CDC laboratories. Security completely collapsed. Mislabeled samples were sent to low-security areas. 75 scientists were exposed to live anthrax spores. Yes, you heard that right. Test mice became ill in just 6 hours. All died within 24 hours. But the truly terrifying part was this. Young mice with the strongest immune systems were the first to die. The virus created a hurricane effect in the lungs. Blood vessels burst. Lungs filled with fluid. Scientists danced with the end of the world every day. If this creature escaped, millions could die. A question for you. Was it worth taking this risk? SARS-CoV. Did you think the 2003 SARS outbreak was over? You're wrong. The incident in Beijing in 2004 showed that the reality was much darker. Dr. Song was weaponizing the SARS virus in a secret laboratory. Yes, turning it into a weapon. Safety rules were ignored. No proper masks, no sterilization. Security expenses were cut for financial savings. Result? Disaster. Dr. Song felt mild fever on the first day, cough on the second day, couldn't breathe on the third day, in the hospital on the fourth day. The lung X-ray was terrifying. Viral pneumonia had covered everything. But the truly horrifying thing was this. His mother came to visit him and got infected. She was on her deathbed within 72 hours. A total of 9 people were infected. 2 died. The Chinese government tried to cover this up. They called it a routine accident. When the World Health Organization pressured them, the truth came out. SARS's 10% mortality rate was remembered. So what else is hidden in laboratories? Marburg virus. 1967, Germany. 31 people working at an innocent-looking pharmaceutical company in Frankfurt contracted a mysterious disease. 7 died in terrible agony. This was the first encounter with the Marburg virus. They were producing polio vaccine with monkeys brought from Uganda. But the monkeys arrived sick and stressed. No quarantine, no veterinary control, none existed. The first victim was Klaus F. He came into contact with monkey blood. Fever started at home in the evening, headache on the second day, eyes turned red on the third day, as if filled with blood, internal bleeding on the 5th day, hospital on the 6th day. The virus rapidly multiplied in Klaus's body. Liver collapsed, kidneys shut down, blood clotting stopped. He died after suffering terrible pain for 9 days. Similar cases erupted in Frankfurt and Belgrade. 37 infected in total. Panic in hospitals. When doctors realized this unknown disease was contagious, they took isolation measures. Media put death virus news on headlines. The German government declared a state of emergency. This was just the beginning. Anthrax, 1979, Soviet Union. In the middle of the Cold War, a terrible accident occurred in the city of Sverdlovsk. Anthrax spores leaked from a biological weapons facility killed 105 people, according to official figures. The real number might exceed 1,000. At the secret facility called Compound 19, biological weapons for missiles were being produced. On the night of April toast during shift change, a terrible mistake was made. The HEPA filter was removed, but they forgot to install a new one. The morning shift was unaware. When production started at 06:01, billions of anthrax spores mixed into the atmosphere. Wind carried this death cloud to the city. It spread 50 kilometers. Microscopic spores settled in lungs. Fatal infection within 1 to 6 days. The first victims came to hospitals 4 to 5 days later. They initially thought it was flu, but the disease progressed abnormally fast. Lungs filled with edema. X-rays showed snowstorm images. Antibiotics didn't work. The KGB intervened. Medical records were hidden. Morgues overflowed. Funeral homes were closed. They said contaminated meat consumption. The truth was confessed by Boris Yeltsin in 1992. This accident showed how devastating biological weapons could be. H5N1 bird flu, 2012, Rotterdam. One of the most controversial experiments in science history was conducted. Professor Ron Fouchier made the H5N1 bird flu virus transmissible from human to human. What he created? A potential apocalypse weapon. H5N1 naturally has difficulty passing from birds to humans. Human-to-human transmission is almost non-existent, but in the laboratory, 5 critical changes were made to the virus's genetics. These changes made it easier for the virus to attach to the human respiratory system. 10 ferrets were used for testing. Ferrets' respiratory systems most closely resemble humans. The result was terrifying. The modified virus spread rapidly through the air among ferrets. All died within 48 to 72 hours. 100% mortality rate. Normal H5N1 has a 60% mortality rate. If this modified version leaked from the laboratory, it could start a pandemic. 30 to 40% of the world's population could die. That means 2 to 3 billion people. The CDC and NIH decided to stop the research. In 2013, a security breach occurred in the laboratory. Virus samples were mislabeled. High-risk samples were sent to low-security areas. 3 researchers were exposed. 21 days quarantine. Luckily, no infection occurred. After this incident, worldwide debate began. The US imposed a temporary ban on such research. What do you think? Was this risk worth it? Venezuelan encephalitis virus. 1995. A terrible accident occurred at Fort Detrick, America's most secret biological research center. Dr. Janet Parker was working on vaccine development on V5V virus, but this was the weaponized version of this virus. V5V is a deadly alpha virus that causes brain inflammation. Its aerosol form could become a biological weapon. The accident happened on Friday at 15:30. While Parker was working with 500 ml of virus culture, her nitrile glove tore. She didn't notice. She continued working for 2 more hours. The virus mixed into her bloodstream through the open wound. The BSL-3 laboratory's ventilation was broken that day. No negative pressure. Symptoms started on Monday. Sudden high fever, severe headache, confusion on Tuesday, hospital on Wednesday. The V5V virus crossed the blood-brain barrier. It reached the central nervous system. Widespread inflammation developed in Parker's brain. She had epileptic seizures. Her memory deteriorated. Motor coordination was lost. 3 months intensive care. Ribavirin and interferon treatment. Months of rehabilitation. She partially recovered, but permanent neurological damage remained. Similar accidents had occurred at Fort Detrick before, but they were kept secret for security reasons. This incident showed how risky the US biological weapons program was. Tularemia. 1950s, Soviet Union. One of the deadliest biological weapons of the Cold War was being developed. Tularemia bacteria, Francisella tularensis, is extremely contagious and deadly. It was produced in tons and weaponized in Siberia's secret facilities. In 1982, a terrible accident at the Vector Institute in Koltsovo, Dr. Sergei Petrov forgot to wear a mask while testing the aerosol form of Tularemia bacteria. He inhaled the bacteria directly. Vector Institute was an ultra-secret facility working with the world's most dangerous pathogens. Petrov was working on weaponized tularemia. This version was 1,000 times more virulent than normal. Antibiotic resistance had been added through genetic modification. A single bomb could infect an entire city. When the ventilation broke down, Petrov ignored the warnings. Symptoms started 48 hours later, flu-like but progressing much faster. Lymph nodes swelled on the 3rd day. Breathing difficulty on the 4th day. Lung pneumonia on the 5th day. Normal tularemia has a 5-monthly 15% mortality rate. The weaponized version had been increased to 60%. Emergency streptomycin and gentamicin treatment. 3 weeks intensive care. He was lucky because early diagnosis was made. 6 months of recovery. This incident showed the true dimensions of the Soviet biological weapons program. Throughout the Cold War, tons of tularemia bacteria had been produced and kept ready to be placed in ICBM missiles. Nipah virus. The Nipah virus that emerged in Malaysia in 1998 was initially thought to spread from pig farms, but the laboratory leak in Kuala Lumpur in 2001 revealed that the reality was much darker. Dr. Chua Kong Beng was conducting weaponization research on Nipah virus samples. This virus, with a 40 to 75% mortality rate causing acute encephalitis, was being developed as a biological weapon by the Malaysian army. Laboratory security was completely inadequate. The virus that should be worked with at BSL-4 level was being processed at BSL-2. HEPA filters hadn't been changed for 6 months. No negative pressure. Protective equipment was old. No personnel training had been done. Monday morning leak. Glass jars broke in the centrifuge. Virus spread into the environment. 3 researchers inhaled contaminated air. Symptoms on Friday. Sudden high fever, severe headache, confusion. Hospital on Saturday night. Nipah virus directly attacks neurons in the brain. Epileptic seizures. Personality changes. Loss of coordination. Speech ability ended. Brain MRI showed widespread necrosis. No specific treatment. Only supportive care. 2 out of 3 patients died. The sole survivor lives with severe neurological sequelae. After this leak, laboratory safety standards in Malaysia underwent radical change. Rift Valley fever. 2000. Cairo. Secret research was being conducted at Ain Shams University. Target: turning Rift Valley fever virus into a biological weapon. The Egyptian army was running a strategic program to collapse enemy countries' agricultural economies. Dr. Ahmed Hassan was conducting gain-of-function studies on different strains of RVF virus. Normal RVF mostly affects animals, causing mild symptoms in humans, but in Hassan's laboratory, genetically enhanced versions were being developed. Target: human-adapted strain with 90% mortality rate. He was working in a BSL-2 laboratory. This security level was inadequate for RVF. Appropriate equipment couldn't be purchased due to financial constraints. HEPA filters had never been changed. Hassan was alone, no security personnel. Thursday afternoon accident. Hassan cut his hand with a scalpel while working with infected sheep samples. He didn't notice the glove was punctured. The virus mixed into circulation through the open wound. This was the most virulent strain developed in this laboratory. Lethality had been increased tenfold through genetic modification. Symptoms 36 hours later: sudden high fever, severe headache, eye pain, photophobia on the second day, liver dysfunction and jaundice on the third day, retinal bleeding on the fourth day, kidney function collapse on the fifth day. Hassan's condition rapidly deteriorated. Blood clotting was disrupted. Internal organs started bleeding. Intensive care, ribavirin treatment. 6 weeks struggle between life and death. He was lucky, early intervention was made. After recovery, permanent vision impairments and kidney damage remained. This incident exposed Egypt's secret biological weapons program. Ebola. 1989. Reston, Virginia. The beginning of Ebola panic in America. Mysterious deaths among laboratory monkeys brought from the Philippines. No one could guess this was a new strain of Ebola virus. Hazelton Research Products supplied live monkeys for pharmaceutical research. 100 macaque monkeys had been imported from the Philippines. 48-hour flight to Virginia. Placed in Reston quarantine area. First week normal. Second week, monkeys started dying one by one. Listlessness, fever, internal bleeding. When veterinarian Dr. Dan Dalgard performed necropsy, shock. Internal organs were completely devastated. Liver rotten, spleen fragmented, intestines full of blood. These symptoms are only seen in Ebola. Dalgard sent samples to USAMRIA. Analysis result was terrifying. Ebola virus positive. But this was different from known strains found in Africa. It was named Reston Ebola. CDC went on alert. Ebola has a 90% mortality rate. Level A hazmat teams entered the facility. All monkeys were killed. The facility was decontaminated. Media ran "Ebola in America" headlines. The public panicked. Virus antibodies were found in the blood of 6 workers. They had been infected but no disease symptoms. Surprising, Reston Ebola was harmless to humans. This was a lucky escape from disaster. But what if it hadn't been harmless? Q fever. 1990. Melbourne. Q fever leak at Commonwealth Serum Laboratories. The biggest scandal in Australia's laboratory safety history. Coxiella burnetii bacteria escaped from the laboratory as a silent but deadly pathogen. Dr. Michael Davis and his team were working on the aerosol version of Q fever bacteria. This bacteria is one of the most resistant microorganisms. It can survive in environmental conditions for months. A single organism can cause infection. The Australian Army was considering this as a biological weapon. Laboratory security systems were from the 1960s, no BSL-3 standard. HEPA filters hadn't been changed for 2 years. Negative pressure not working. Most critical error. The aspirator fan of the biosafety cabinet was working in reverse. It was blowing contaminated air back into the laboratory. When Davis was working with high-concentration bacterial culture, the aspirator broke down. Bacteria scattered into the air. Davis and 3 colleagues inhaled the aerosol. Q fever symptoms start 10-14 days later. No one is aware of the infection during this time. On the 12th day, Davis had symptoms. Sudden high fever reached 40 degrees. Severe headache, muscle aches, sweating. Atypical pneumonia in the lungs. Q fever turned into chronic form. Davis' heart valves became infected. Endocarditis developed. 6 months antibiotic treatment. Permanent heart damage remained. 3 colleagues had similar symptoms. This incident led to radical revision of laboratory safety standards in Australia. Lassa fever. 2004. Yale University's Virology Department. Postdoctoral researcher Dr. Elizabeth Bray was exposed to a fatal accident while working on Lassa virus. This African origin virus is among the most dangerous pathogens with a 15-20% mortality rate. Bray was working on neurotropic variants of Lassa virus. These strains show affinity for brain tissue and can cause encephalitis. Research funded by CDC and NIH. Goal: understand viral encephalitis mechanisms and develop antiviral drugs. Highest security in BSL-4 laboratory. Wednesday afternoon accident. While Bray was drawing virus culture into a syringe, the needle tip hit the bottom of the glass tube. In the rebound, the needle entered Bray's left index finger. Despite wearing double gloves, the needle penetrated both layers. 0.1 ml of high-concentration virus mixed into her skin. No symptoms for the first 48 hours. Mild fever on the 3rd day. Headache on the 4th day. Nausea on the 5th day. Sore throat and difficulty swallowing on the 6th day. Characteristic symptom of Lassa fever, retrosternal pain on the 7th day. Hospital on the 8th day. Bray was isolated, taken to a special negative pressure room. Ribavirin antiviral treatment started. Lassa virus causes bleeding by attacking capillaries. Nosebleed on the 9th day. Bleeding from gums on the 10th day. Abdominal pain on the 11th day. Suspicion of internal bleeding. 3-week struggle between life and death. She was lucky because early diagnosis and treatment saved her life. Hantavirus. 1993. Los Alamos National Laboratory. Dr. Richard Stone neglected safety protocols while working on sin nombre hantavirus. This virus was feared with a 40% mortality rate by causing pulmonary syndrome. Stone was researching the aerosol properties of hantavirus. Los Alamos conducted biological defense projects alongside nuclear weapons research. Hantavirus study was aimed at developing biological weapons targeting agricultural workers in enemy countries. The project was classified as top secret. Stone was working with virus isolated from infected deer mice. Mice were killed and tissue samples were taken. Most critical stage, homogenizing mouse lung tissue. Microscopic aerosol formed during this should be done in BSL-3 cabinet. That day, the BSL-3 cabinet was under maintenance. Stone worked on a normal bench because he was in a hurry. He wore a simple surgical mask instead of N95. When the homogenizer was running, the container lid flew off. Mouse lung homogenate splashed on Stone's face. He inhaled hantavirus aerosol. He didn't write a contamination report. Symptoms 14 days later. Flu-like symptoms, fever, muscle aches, fatigue, shortness of breath on the 2nd day. Rales in lungs on the 3rd day. Bilateral pulmonary edema on the 4th day. Hantavirus pulmonary syndrome was diagnosed. Stone was taken to intensive care, connected to artificial ventilation. ECMO support, his lungs were completely filled with fluid. 6 weeks in coma. He was lucky because he was young and healthy. He slowly recovered but lung capacity dropped to 60%.